America, there are people who have different diseases ranging from cancer to edema. Among all the well-known diseases, there are also the diseases that people are unfamiliar with, such as Crohn's disease. Everyone knows what a cancer is because millions of people have it, but not very many people know what Crohn's disease is. Today I will be telling you a little bit about Crohn's disease and what it is, its effects on the body, symptoms, treatment options, and how to be diagnosed. Crohn's disease is a gastrointestinal inflammatory disease that targets the digestive system, ranging from the mouth to the anus. It affects people between the ages of 15 and 35, and nearly 500,000 women and men in America are diagnosed with it. Crohn's disease runs in families, so if a person who has the disease has children and other family members, they are most likely to get it sometime in their life. According to the Oregon Health and Science University website, about 20% of people who have a relative with Crohn's disease will most likely have an inflammatory bowel disease sometime in their life. Crohn's disease was discovered by Dr. Burl B. Crohn in 1932 when he and two of his colleagues wrote a landmark paper describing the disease. Just like any disease, Crohn's disease has many different symptoms. A few of the symptoms are abdominal pain, diarrhea and constipation, weight loss, rectal bleeding, oral and rectal fissures, blockages, vitamin deficiencies, calcium deficiencies, acid reflux, and a depleted immune system. Crohn's disease not only has physical effects, but it also has emotional effects. People with Crohn's disease usually have depression because they aren't able to do the things that they want to on a regular basis. According to the Crohn's and Colitis Foundation of America website, researchers believe that the immune system mistakes bacteria that is normally found in the intestines for a foreign substance. So then the body attacks it and sends white blood cells into the lining of the intestines, where they produce chronic inflammation. The cells then generate different substances, and they lead to ulcerations and bowel injuries causing Crohn's disease. Here are some pictures of my father. This is before he had Crohn's disease. He was healthy here. This one is when he was diagnosed with Crohn's disease, and these are about a year apart. And then this picture is when he was on a drug called prednisone, which made his face very, very puffy. After noticing a combination of these symptoms, a person who thinks that they have Crohn's disease will have to go to a doctor and have them diagnosed. To be diagnosed with Crohn's disease, one has to go through a series of tests, which include blood tests, colonoscopies, endoscopies, and stool culture tests. A blood test determines if there is anemia resulting from blood loss and if there are an increased number of white blood cells in the body. A colonoscopy lets the doctor view the entire large intestine and helps them identify abnormal growths, inflamed tissues, ulcers, and bleeding. An endoscopy helps the doctor examine the whole digestive tract and look for damaged tissues and ulcers. Once the tests are done and the doctor has diagnosed a person with Crohn's disease, they will give you some treatment options. There is no actual cure for Crohn's disease, but there are different medications that will help one with Crohn's disease have the symptoms calm down. A few of those drugs are antacids, sulfa drugs, Remicade, methotrexate, prednisone, Azicol, and Cimzia. Sometimes surgery is needed if there are parts of the intestine that are not able to be repaired by drugs, so they have to take them out. Even though Crohn's disease isn't very well known, it still affects thousands of people in America. I hope that you you learned a little bit about a disease that hits pretty close to home for me, and that you are able to share this with other people.